Lakeview Health. Good morning, Gina. How are you?
Hi, Kevin. I'm good. Very excited today.
Yeah, we're excited to have you here, and we're going to talk about Lakeview Health and what that's all about, and the benefits for people here in St. Johns County, what could be done for folks who may be dealing with drug and alcohol addiction. You also brought along, though, a very special person as well. You got a special guest today.
I do. I'm very excited to have Chris here from the Augustine Center. Hi, Chris.
Good morning. Thanks for having me, guys.
Yeah, and Chris, we appreciate you being here again. We've been on the radio before in a different capacity, right?
Yep.
Shows how multi-talented you are, you know?
Yep.
So talk to us a little bit about the St. Augustine Recovery Center.
The Augustine Recovery Center is here in St. Augustine. We have been offering addiction treatment for a year now. We're a long-term residential treatment center for men.
Okay. All right. Good stuff. So, Gina, Thorne, help me understand the connection, the relationship between Lakeview and the Augustine Recovery Center.
Yeah, so we're very excited to have people like Chris in our community because we know that addiction affects 1 in 10, and there's 22 million people suffering from this disease. Lakeview's been very fortunate to build partnerships with groups like the Augustine Center because we know that when we do the work that we do, sometimes people do really well, and sometimes they may not, and sometimes we might need to refer them to other places. And so when we have folks like the Augustine Center in town, we can refer them to the Augustine Center. Sometimes we do reciprocal, where Augustine and Chris will call us and let us know that there might be a client that needs treatment. They may not be able to get into their program, and so Chris will give us a call and ask us if we might be able to take their client. So there's a lot of opportunity for making sure we get people to the right places, and so we're just really excited to have folks like Chris and the Augustine Center in our communities because we know that they work with us to help us address this issue of addiction.
That's Gina Thorne once again with Lakeview Health, and you can learn more about Lakeview Health if there's somebody in your family, a friend, neighbor, someone in your circle of contacts who could benefit or they have questions about drug and alcohol addiction treatment. Call 866-316-5113. We're going to put that number up on our Facebook page. Also, if you'd like to message us, we're live this hour. You can do that through Facebook. Just send us a message, and we will present that to Gina and Chris, and if they decide to answer it, they will.
Yeah, we'd be happy to talk to you.
Yeah, so do that, or you can go through our website at staugustineradio.com and just click on the Contact Us button, and we'll be happy to go from there. So, Chris, I noticed in your briefing of what the Augustine Recovery Center is all about, you said it was for men only.
Yep.
Yeah, so talk to me about that, because I know Gina also, they do very gender-specific work at Lakeview, but talk to us about why men only.
Well, we're privately owned by a husband and wife team. And, we just have a strong passion for helping men. I think that gender-specific treatment is really important. I personally know that it can be hard to be truthful in therapy and in counseling if you have a member of the opposite sex in that group with you. And that's part of the reason why we're focusing on treatment for men right now.
Okay.
Yeah, we talked about that last time.
Yeah,
It's important for us to look at, what are the needs of men and what do they need separately from women, how sometimes there can be distractions.
Right.
Yeah.
And Gina, of course, at Lakeview, there's a new facility, right, for women. Right?
Yes, yeah. So we've got the Rose that opened up about almost a month ago. I can't believe it's almost been a month. It's crazy. And we're so excited to be able to offer this unique program for women who are struggling with addiction and mental health disorders. And again, opportunities always arise where we're looking for outside referral sources where we can work with people who are helping women and men trying to recover.
That's Gina Thorne once again with Lakeview Health, and you can reach her at 866-316-5113. And Christopher Blauvelt is here as well. And Chris, give us a short summary. So when a man enters your facility, I mean, what's kind of a sense of what have they been typically dealing with? Kind of give us, I know there's not a typical profile, but what might be an example of somebody here in St. Augustine or St. Johns County who's going to benefit from the Augustine Recovery Center?
Well, what we've kind of done is we've built our program for the chronic relapser who has been to multiple treatment centers. So we're small. We have 16 beds, and we're 3 to 4 month long stay. So most of the guys who come see us have been to treatment before or have recently overdosed, and they need that specific intimate level of care.
Right. So I guess, Gina, that's where you guys would work with someone like them. This would be somebody who has been to maybe Lakeview and they have relapsed after the fact?
Sure, absolutely. So if we have people that need that longer length of stay, we can certainly work with them. But if they're needing more of that specialized treatment, we refer them over to places like the Augustine Center. So, having that unique approach like Chris's group and what we're doing now is really important. We're starting to see from a field in general in relationship to this whole idea of addiction treatment is that when you separate the genders, you get better outcomes. You definitely see more improved results and longer remission rates.
Right. If somebody's listening to us right now, Gina, and they have questions about Lakeview Health, obviously you guys have a great website. What's that web address?
It's lakeviewhealth.com, lakeviewhealth.com. They've got great photo galleries and virtual tours that people can take a walk through our campus. If they can't get up to visit us, we want you to take a look on our website.
All right. It's 13 minutes after 9 o'clock. We're live in St. Augustine this morning. 85 degrees already, on our way up to a high in the mid-90s. Cheap Trick here on St. Johns County's 103.9 FM, and we're spending time on this Friday morning like we normally do with Gina Thorne from Lakeview Health. Good morning, Gina. How are you?
I'm good, Kevin. How are you?
Well, I'm doing well. So give me a sense of a typical patient that may come to Lakeview Health from right here in St. Augustine or St. Johns County. What might they be struggling with? Give us a sense of what maybe their profile is all about.
Sometimes most of the time what we're seeing coming into Lakeview is let's talk first about the female side. We might have your young female that's 18 to 27 who's been struggling with depression or anxiety for a long time. They may not have had the ability to manage any kind of medications to deal with those mental health issues. And so they might start self-medicating. They might be using drugs or alcohol to cope with some of those mental health issues. Some of them are employed. We do have quite a few of our women who come in who have been working moms for a long time, dealing with lots of stress and anxiety, and again, using alcohol and drugs to cope with those issues. And so when they come into Lakeview, our focus primarily is to help them become abstinent from drugs and alcohol. And then secondarily, how do we help them deal with their mental health issues so that they don't need to self-medicate?
Right. That's Gina Thorne once again with Lakeview Health. If you have a loved one, someone in your circle of friends, maybe you know somebody who has confided in you that they're dealing with a family member who is struggling with drug and alcohol addiction, we would encourage you to reach out to Lakeview Health. You can always call to just, get some of your questions answered. Toll free, 866-316-5113. That's 866-316-5113. We've just put all that information up on our Facebook page at WSOS Radio, so you can access that. And once again, Lakeview Health located really close by, too, so you won't be far away from a loved one or a family member. What are you seeing trend-wise, Gina, in terms of, what's the latest? We hear all these stories on television about, an Oxycontin epidemic, people going from prescription pills even now to heroin. We had Sheriff David Shore from St. Johns County on the radio here just in the last couple of days saying that he is seeing an explosion of heroin use among middle-aged, what we would call soccer moms in Nocatee and Palencia and places like that.
Right. So people are shocked by that. You wouldn't think that would be the case. And the reality is, and I'm sure he spoke to this as well, is that a lot of those folks were probably using pain medications for a long time. Right. And when we saw the absence of these pain pill mills go away in Florida, they needed to find quicker, easier ways to get access to these medications. And so, of course, when those went away, they started moving to heroin. So yes, it is an epidemic, and it's a huge concern, not just nationally, but obviously in our own backyard, that we really need to take a stronger look at and figure out how we're going to address this as a community.
And I guess my takeaway when you state that, Gina, is that maybe that should there should never be any shame involved in this anyway. If you're a family member, you're somebody that's struggling with this is a disease, this is an issue that people are having to struggle with. Mm-hmm. But understand that it is much more widespread than you might think.
Right. So we talked earlier, 1 in 10 are affected by this disease. So there are people that you work with side by side, I'm sure, on a daily basis that you wouldn't even know is in recovery. And so there's a lot of people out there that are living this disease on a regular basis. And then those that are working a recovery program that are functional members of society. And so you're absolutely right. The shame and stigma that's attached to this disease can be a barrier for people seeking treatment. Our focus is to help reduce those barriers and let people know that if you were struggling with heart disease or if you had diabetes, you wouldn't hesitate to get help. We want people to have that same approach to addiction. Wow. They can get help. They can get better. People live long lives in recovery every day. Right, Chris?
Yeah, absolutely.
Chris is here with us, and he is with the Augustine Recovery Center, and they partner often with Lakeview Health. Mm-hmm. And Chris, kind of give us your story a little bit, because it's a very St. Augustine story.
Okay. Well, I am personally in recovery from drugs and alcohol. Mm-hmm. And, my story is it's not unique. And by that I mean drugs and alcohol were just the solution, and I was the problem. And just like Gina was saying, I was unable to find a solution to the problem, to me. I was.
How long do you think you were struggling with drug and alcohol addiction before you?
Half my life.
Wow.
Yeah.
So from what age? I mean, you're a young guy.
It was blurry, Kevin. 14
Wow.
or 15.
Wow.
Yeah.
And were you here in St. Augustine at the time?
I grew up in Pennsylvania.
Okay.
So I'm a Yankee.
Okay.
Yeah.
All right. And how did that present itself? I mean, for our listeners out there who may be parents or grandparents to a 14 or 15-year-old, give us the details of how that started for you.
I grew up in a really great home in a really great town with amazing parents, and I was just bored. And, it had nothing to do with my upbringing. I would have, if my parents kept an even closer eye on me than they already had, I still would have broke out and rebelled out eventually. So I think it's important for parents to know that, no matter how you parent your children, it's, the disease of addiction, it doesn't pick and choose, and it doesn't discriminate. It's a use disorder, and it can present itself in any form or fashion anywhere.
And I bet that you started out recreationally at first.
I did.
And then it evolved over time
Yep.
into full-blown addiction. So it's not something that just you wake up one day and you're all of a sudden you're an addict.
Yeah.
Chris is with us once again from the Augustine Recovery Center right here on US 1 South in St. Augustine. Talk to us a little bit about that transition to what Gina just pointed out. You started out, you're 14, 15 years old, you're bored, you do, I guess, recreational marijuana or what have you.
Yeah.
Talk to us about the escalation. So how did that happen, and when did it happen? Did it happen a year or two after recreational use, 6 months?
It happened pretty quickly.
Wow.
I had been arrested twice for DUI by the time I was 21 years old, and I was facing some pretty serious consequences. And, those consequences really didn't break the chain of addiction for me. And my addiction followed me through high school and through college. And I just was unable to break the vicious cycle. And it morphed into some really dark times for me. And I traveled all over the country trying to, it's called the geographical fix, which doesn't ever work, I can assure you. And, I got scared. I got scared one day, and I reached out for help, and I was able to go to a treatment center much like Lakeview, and it's been different ever since.
Wow. That's great. Well,
and let me mention also that one of the things that Chris points out is that the nature of addiction impacts much earlier for young adults and for children. So the brain doesn't fully develop until 25. So one of the reasons why we're so adamant in trying to keep kids from starting is that if you start before the age of 25, you're going to have a much faster response to addiction and becoming full-blown addict than somebody who starts at later in life, because the brain's just not fully developed yet. So it's really important for parents that are listening today that if you're learning that your kids are drinking recreationally, or if they're smoking marijuana and you think it's benign, it really isn't benign. There's a lot of evidence out there that talks about how addiction happens more rapidly with a young brain. And we're not proposing that it's okay to wait until they're later in life. We don't want them to use any kind of mood-altering medications at all. But it does obviously sit very closely to what Chris is saying, that his addiction happened very quickly because he started very young.
Right.
So just something to think about.
Right. Yeah. At what point, Gina, and just hearing a little bit of Chris's story, obviously, which is amazing, but obviously you can help people at any stage of the process, but he starts at 14, you're a parent, maybe you have some sense that your child is engaged in recreational use. I mean, is there a way to prevent them from making that next leap, or do you can't help anybody till they've already made the leap? I mean, where in that whole process that he experienced does Lakeview help people?
So we're always a big proponent of prevention and advocacy and trying to get people to not start. And obviously having good, what we call protective factors that are built into the community are very important for people. So in the case of what we do here at Lakeview, we actually are now taking clients and patients coming in when they're either in the early stages of their disease. We have those that might be farther along in their disease, where they're chronic, Chris mentioned chronic relapsers that have, worked really hard to stay sober for periods of time, and their remission rates might be 3 months, 6 months, 9 months. And obviously when you come out of treatment, if you're able to, continue expanding your remission rates, then your success for long-term sobriety is greater and greater every time. But this is a relapsible disease. That's just the nature of it. Not to say that you can't be and stay sober after your first treatment experience, but there is a 40 to 60% relapse rate that does occur within the first year. But we work very hard to build aftercare and support for people to help them. So when clients come into our program, they're already farther along on the spectrum of their addiction, that they need an inpatient experience like ours because they need structure. They need to be sort of in an incubator of recovery, if you will, where they're eating and breathing and sleeping recovery every day, and being around other like-minded folks so that one addict can keep another addict honest. And that's really important. I mean, I can spend all day talking to people about why they shouldn't use, but it's the person who can actually sit across from them and have the same story. Maybe the details are a little bit different, but that ability to relate to that person helps them learn that recovery is possible. So a little farther along in the addiction spectrum, but I would say, organizations like PACT here in St. Augustine that does a lot in working with prevention and intervention is a great place for people to start in trying to address how do we prevent people from starting.
It is exactly 9:30. We're live here in St. Augustine. That voice is Gina Thorne. She is with Lakeview Health. And, of course, they help people who are dealing with drug and alcohol addiction each and every day. And Chris Blauvelt is here as well, and he's an admissions coordinator and works on outreach for the Augustine Recovery Center, which is a group that often works with Lakeview Health. And Chris, you're obviously dealing with people who do relapse, just like Gina was talking about. How do you connect with those folks? I mean, when you're working with them, I mean, what can make somebody who is a man, because you only deal with men at your facility, who has relapsed on repeated occasions? I mean, not to give away the whole story here, how you help them and treat them, but what are the techniques that can help somebody get beyond relapsing?
I think creating a strong, close-knit recovery community where that person feels like they're a family member and that they're loved and they belong will help them come back if they do relapse. Because a lot of people relapse and they feel like they're alone. They feel like they're ashamed,
they failed,
and that they're going to be shunned from that community. And I think if the community that kind of grew their sobriety is really strong and loving and supportive, they'll be more encouraged to come back to that community once they have relapsed, if they have relapsed.
Wow. Interesting stuff. Well, obviously, if you have any questions at all, we encourage you can always reach out to us via Facebook. Even after we're done with the broadcast here today, we'll forward those questions on to Gina Thorne. In the meantime, you can always call Lakeview Health at 866-316-5113 or go to the website,
lakeviewhealth.com.
All right, we'll be back. Dexy's Midnight Runners here, and Come On Eileen on 103.9 WSOS. Hey, we're live in St. Augustine this morning. We're spending time with Gina Thorne from Lakeview Health, and Lakeview Health, of course, has helped so many people here in St. Johns County deal with drug and alcohol addiction and have started people on the road to recovery, right, Gina?
Yes, we have. We're real happy with being a resource for the folks in this community, and we want to be a solution for folks who are struggling with addiction and mental health disorders.
Absolutely. And, of course, Gina brought along a special guest today. Maybe you can reintroduce your special guest.
This is Chris with the Augustine Center, and I learned recently that Chris actually has a long-standing history with surfing, which I thought was really cool because we both do the surf therapy programs.
Right.
So we were talking about that off air, so I wanted to talk a little bit about that.
Yeah. So, Chris, explain how surf therapy works.
Okay. Well, Lakeview and the Augustine Recovery Center both use surf therapy to help our guys do a couple things. Stay rooted in the moment. You know, in recovery, it's hard to stay rooted in the moment. You're thinking about the future. You're ashamed of the past. And surfing helps you connect with the present moment. It also helps you connect with something bigger than yourself. Recovering drug addicts are naturally very selfish and self-centered. And surfing helps you connect with the ocean. It helps you connect with life outside of treatment and outside of the struggles that you're going through. And then, you know, the following day you can process it and you can talk about how those things affect your recovery, how they affected your thinking. Was there teamwork involved? Were you able to bond with the guys and the gals that you're in treatment with?
Right. That's good stuff.
Yeah,
And
we
so-
actually use Saltwater Cowgirls to work with us. We
Right.
talked about this once before, so they've been really great in trying to help us with our clients. Look at the similar things that Chris is talking about, which is a lot of metaphor work. How do you look at the waves coming at you? It's not kind of like the triggers in life that come at you in your recovery. So how are you going to overcome those? And how are you going to balance on the board? How are you going to balance your recovery? So, and surfing is really hard.
Yeah,
and I tried it a couple weeks ago.
It's hard, isn't it?
I couldn't get up.
And it's always
crazy.
different. Like recovery,
Right.
no one day is going to be the same, and the same is true of surfing. Every day is different.
That's Chris once again with the Augustine Recovery Center here in St. Augustine, and they partner with and work with Lakeview Health as well, which describe for our listeners, if they're just tuning in, Gina Thorne, just once again, what is Lakeview Health?
So Lakeview is an inpatient residential treatment program. We treat people 18 and over with substance abuse and mental health disorders. Folks that come into our program have to have a primary diagnosis of addiction. We can't admit you if you're psychiatric first, but we can treat both. We've also been very good at treating people with significant medical acuities. So oftentimes when people come in with addiction issues, their bodies have been racked with other issues like liver failure. Some folks come in with Hep C. Some folks are coming in HIV positive. There are facilities that may not be able to take those types of clients, but we've got this amazing medical staff, fully staffed, to address those issues. Not to mention that we're also tied into a community where there's lots of great hospital systems that we also partner with. So when we're dealing with individuals who come into our program, we're looking at the holistic approach. So it's not just the absence of drugs and alcohol, it's looking at the whole body, mind, and spirit concept. So we're dealing with the psychiatric issues, we're dealing with the physical issues, we're dealing with the spiritual issues. So our focus is to really help people in their early years, early time of recovery, to really look at what's the foundation that we can lay for them so that when they leave treatment at Lakeview, they'll have a good start to their recovery journey.
Wow. And Chris, you spent some time at Lakeview, right?
Yeah, I have. I've been there multiple times. It's beautiful.
Yeah. Talk to us about your sense of what works with people, not just, your perspective is very St. Augustine, obviously, and you work right here at the Augustine Recovery Center, but what are you seeing? Because I don't know of many families that are not touched by alcohol and drug addiction. So a lot of them, I think, are just looking for words of hope and inspiration. So what are you seeing out there that's working?
What I'm seeing that's working is getting the families involved, because most of the time the families are just as sick, if not sicker, than the struggling addict. And what I'm seeing is educating the families on how it is a family disease and how it can trickle down throughout the different family members, getting them involved with their loved one's recovery, educating them on the disease model of addiction, prevention, what recovery looks like, what long-term, lifelong recovery looks like. I'm seeing that work.
Okay. And Gina Thorne, I would imagine there's a role for families too when they're involved in the programs at Lakeview Health.
Right. And I would say that anybody who's looking for treatment always needs to ask that question when they call, because if you don't have a family component that's part of the treatment experience, then you're missing half the solution. And Chris is right. This is a family disease. At Lakeview, we have an intensive 3-4 day program where families come in and they learn to understand what this whole recovery journey is about. Oftentimes, families will drop their loved one off at treatment and say, "Just fix them. I'll come back and get them when they're all better." Yeah. And we say, "Hold on a second. We need to start talking about your recovery work." So this isn't just about your loved one and dealing with their addiction. This is about how the whole family system works. And it shouldn't be a shame-based issue. It should be looking at how do we help your family get healthy again? How do we address the trauma that's happened in the family, the trust that's been broken, the boundaries that are not there? We talked one time a couple weeks ago about this issue of codependency, which I'm sure Chris and I have probably talked a lot about in regards to how do we help our families realize it's not okay to keep picking your 45-year-old son up at the hotel who's gone on a weekend bender and doesn't know where they are. So there's definitely a lot of work that needs to be done with the families, and we certainly do that at Lakeview to try to give families a place where they can air their issues and hopefully start their road to recovery as well.
Right. Well, once again, if you have any questions at all about the approach that Lakeview Health takes, we would encourage you to make a call and ask those questions. You'll do that in complete confidence, obviously. Just call this number, 866-316-5113. That's 866-316-5113. We've just put that telephone number up on our Facebook page at WSOS Radio. So if you're driving around, you can just check that out when you get in front of a computer and jot that down and give them a call. Or you can go online anytime, day or night, and they have a very extensive website that will give you a good feel for what Lakeview Health's approach is all about, right?
It is. It's lakeviewhealth.com, lakeviewhealth.com. We've got great information on there with folks needing questions answered. We can give you a tour. You can see the different photos of the residences, of the dining facilities, meet some of our staff online so that you can see, touch, and feel what we do at Lakeview.
All right. And Chris, of course, they can always go to AugustineRecovery.com too, right?
Yep.
And learn more about what you guys are doing. All right. We will be right back, so stay tuned. The Archies with a big hit from back in the early 70s, and Sugar Sugar. Interesting little side story of that. One of the members of that studio band that did that song actually lives in Ormond Beach.
Oh, really?
Yeah.
Oh, cool.
And called me one day when we had played that song.
Oh, really?
and then I looked him up on Wikipedia or whatever, and sure enough, this was he was telling the story about this on the air just spontaneously one day, that they were in a recording studio. They were just one of these backup kind of studio bands that were working on a variety of commercials and stuff. And somebody asked them to just do this little song that somebody came up with, and they knocked it out and they left. And 2 years later, it was released as a single.
Oh, my goodness.
And
did he get royalties from it?
Oh, yeah.
Good.
He says, I still live off of it. He says, I still go to like
awesome.
Publix and cash the check. And
Oh, that's funny.
the only hit he was ever a part of. And yet I'm like, well, that's a song that really multiple generations know the words to that
For
song.
sure.
It's pretty
Absolutely.
phenomenal. He said it took us probably 26 minutes to do that song. And it's his life work. But anyway,
Awesome.
Little side note, but we're spending some great time. Of course, Chris is here from the Augustine Recovery Center, and Gina Thorne is here with Lakeview Health. And Lakeview Health, a big part of our family here at WSOS, and we appreciate their sponsoring local radio here in St. Augustine and St. Johns County. And Gina, explain to us a little bit more about Lakeview Health quickly, and then also maybe reintroduce Chris to our audience so that they understand what he does at the Augustine Recovery Center.
Absolutely. So Lakeview actually is a gender-specific treatment program where we treat men and women separately for substance abuse and mental health disorders. We have the Rose at Lakeview that just opened up about a month ago for women specific. We do a lot of work with trauma-based work. We're trying to help them look at life balance, and many of our women that come in are struggling with family and work. They're looking at self-care issues. They're looking at self-esteem issues. And so we really try to create a warm and safe and worthy environment for them. There's a lot of issues for women when they come in where they just don't feel worthy. And so when they come into our program, we create a space for them where they feel like they can get better. And then we have the STAR, which is our men's program, very gender specific, focusing on kind of building that brotherhood of camaraderie for men who are looking for ways that they can foster healthy relationships with other men, looking at issues around anger and anxiety and trauma as well. And so these two programs are both sit on the campus of Lakeview, and we offer a wellness component as well. So our focus is to help them get physically fit. So it's a comprehensive program, and we're really excited to have it in our community. But we're also equally excited to have people like Chris in our community who works with the Augustine Center. We do a lot of work with other treatment providers because we know that not everyone is going to do 100% in one particular program. So sometimes we might need to cross-refer. And so there are cases where we may call Chris and say, hey, we've got someone who might do better in your program. Would you be interested in working with them? And vice versa. And so and then on top of that, we've got just this prolific issue of addiction. We've got 22 million people plus that are suffering from this disease, and only 10% are actually accessing treatment. So we know that the need is out there, and so having programs like ours in the community are really helpful, and having partnerships with people like the Augustine Center are equally helpful.
Well, that's good stuff. Chris, kind of give our listeners, too, a quick summary of what the Augustine Recovery Center does. You're located right here in St. Augustine on US 1 South.
Yep. We're happy to be here and offering addiction treatment to the St. John's community. We're long-term residential treatment for men over the age of 18.
Okay. All right. And if somebody is interested in that sort of treatment, what's the process? Do they just show up after having a particular bad event, or, how does this all work?
Well, they can visit our website at www.augustinerecovery.com, or they can call me, and we can just kind of go through some questions. How are you doing? What do you know about our place? And we'll see if you're a good fit for the Augustine Recovery Center.
Yeah, I was asking Chris that question, but Gina, I think some of our listeners out there, if you have someone in your family who's struggling with alcohol or drug abuse, we've seen these crazy TV shows about interventions, and Sometimes it seems like it takes a seminal, dramatic event to bring about, entering treatment. But how does this normally work? Like if they're, because I think a lot of families don't know how to put their arms around that notion. You have a loved one, a child or a parent or a sibling, and they're struggling with drugs and alcohol. How can you sort of make that happen where they actually go into treatment at Lakeview Health?
Sometimes it's a matter of just educating them. So if they make a phone call to us, our intake department that's 24/7 is available to answer questions about what is going on with your loved one and what can we do to kind of help usher them into treatment. And there's a very detailed screening process that we go through that's approved by the American Society of Addiction Medicine that kind of looks at, where is your loved one fall on the addiction spectrum that would require them to be in treatment like ours. Because there are some people that may not necessarily need residential treatment right away. They might do really well in outpatient treatment. But then there are those like Chris's group and our group who might have people that are acutely addicted that really need inpatient treatment because they've tried multiple times outside the community and they can't do it. So having the opportunity to talk to someone, whether it's someone in our intake department or someone who's in the community that you might want to reach out to, another therapist, maybe even talking to your primary care doctor, because sometimes they have assessment tools that they can help you with that'll help you identify where your loved one sits on the addiction continuum. And then from there, you can look at next steps, which would look at resources and referrals. And again, our staff is available all the time to answer questions about that, and we'll help direct them. Sometimes they may not come into our program. They might go to places like the Augustine Center or an outpatient program here in this community. So we definitely have the resources available to answer any question that you have related to this disease.
Sounds like the first step, though, is to make the call.
Always
check
make
out the website and just get a little better educated. That's not going to cost you a dime. You're going to get a better understanding of what you can do for that loved one who's struggling with drugs and alcohol. That number is 866-316-5113 for Lakeview Health right here in Northeast Florida, 866-316-5113. We've put that number up on our Facebook page at WSOS Radio, so just search for that, and it'll all be there for you. And, of course, Chris, obviously here in town, your website is...
AugustineRecovery.com.
That's right. Gina Thorne, thank you very much.
Thanks so much, Kevin.
We learned a lot. Chris, thank you.
Thank you both.
And Gina, we'll hear from somebody else from Lakeview Health next week.
That's right.
We're
Absolutely.
looking forward to it. All right. Have a good weekend, guys.
You
too.